This is an example of a methyl B-12 injection. What this does is this comes from a compounding pharmacy, a pharmacy that actually makes this up themselves in a special formulation. And it comes as a pre-filled syringe. So what happens is when you get this in the mail, it already comes pre-filled with a determined amount based on the child's weight. If you put it up against my skin, you'll see how small the needle is. It's very, very small. And this is what a diabetic would actually use to inject insulin. This is actually an injection that is going into the buttocks. So a child receives this in the sort of upper outer quadrant of the buttocks, in this, what we call the subcutaneous tissue, about every 3 days. Most B12 injections are actually given in the muscle, either in the buttocks or in the arm. The key to this is that this is actually given at a very sort of narrow angle, as Dr. Newbrander had first described, at a 30-degree angle or less. So the more narrow you can go, and this is just an example off of an apple, but you're trying to get it underneath the skin in the subcutaneous tissue. And you get it under the tissue, you squeeze in the medication, and you're done. Now, the nice thing is this does not hurt. It's not a painful injection. Most kids don't even feel the needle. They might, if anything, feel a little bit of the medication going underneath their skin. Now, one little trick that you can do, and what I commonly do with the parents I work with, is I give them something called EMLA cream, which is a lidocaine anesthetic cream. They can rub into the skin about 30 minutes before the injection, and that will just take away any sort of numbing. Take away any sort of pain that might be associated with this injection. Parents implement this treatment when their kids are asleep at night. So they might actually do it when their kids are asleep. Some parents choose to do it during the day because they know it's going to be kind of an ongoing therapy that their kids need, and it's just part of their overall program. Your technique as far as injecting it, as I instruct people to do, is kind of like you're going to throw a dart, where you put it between your thumb and your index finger. You're actually going to put it through your second finger and your thumb, and that way it gives you a little bit more control. You inject, push, and done. That simple.